All right. Well, hello, everyone. Thank you all for joining the PFCC Partners March workshop. My name is Lindsay Galley. I'm the Director of Education for PFCC Partners. I'm located in Sacramento, California, and I'm very excited to see so many new and familiar faces with us. I appreciate you taking an hour out of your day to spend some time and learn along with us today. We are thrilled to have a few members from the Open Notes team, who I will introduce in just a moment, join us for this workshop to talk about how transparency can forge better care and stronger relationships, how note transparency can forge those better relationships. So before I pass it off to the team at Open Notes, I quickly wanted to review Zoom. We are Zooming. We have been Zooming for a year and more. We have some time in this workshop to do some Q&A at the end. I received a lot of great questions through the registration, so thank you for all of you who submitted those questions. If at any time you have a question in today's presentation, please put them in the chat box. You can find the chat box and all of the other tools you'll need to access Zoom by hovering over your screen and finding the toolbar. If you have some background noise, you can mute yourself. We also have Laura Jackson on to manage that as well if you forget. So no worries either way. And then it's great to see so many smiling faces. Thank you all for using your videos. It's a great way for us to connect virtually. So if you don't have your video on and you would like to, you can click the Start Video button on your Zoom toolbar as well. And then during our Q&A at the end of the session, if you would like to come off of mute, a good way to let us know is by clicking the raise hand button. And you can find that button by, again, hovering on your screen, clicking participants. And then for some, it might look different. So it could either be a blue button that says raise hand, or you might have to click the more button and there's a little blue hand there. So you can click that and we will be able to see that you would like to come off of mute. Or you can just chat in. We'll be monitoring the chat box throughout the presentation as well. Okay, so before I get to our presentation, I really quickly wanted to introduce our organization. We are PFCC Partners, and we are a patient-driven organization. Everyone at PFCC Partners serves in the role of patient family advisor at our local hospitals to national partnerships all across the country. And we utilize our experiences as patient family advisors and patients and families navigating the healthcare system to support the partnership of healthcare providers and patients and families, because we know that the best possible health outcomes happens there in that partnership. And so this is kind of a visual of what I just described. We utilize our roles as patient family advisors and patients and families in the health system to develop strategies to support other patient family advisors who are partnering with healthcare organizations, and then to develop strategies for patient and family centered care structure and culture to support those healthcare organizations to partner effectively with patients and families who are served at their organizations. And one of the ways that we do that is through the Patient Family Advisor Network. The PFA network is a national network of patients and families using their lived experiences to influence healthcare. Our vision for this network is to facilitate a community of highly engaged patient family advisors that grows each of its members' competencies in partnering to co-design effective healthcare systems, processes, and policies across the country. We do that by building community, providing skills exchange opportunities, and tons of opportunities to engage with the health system at any level, nationally, regionally, or locally as well. So I will put a few links, or maybe I'll ask Laura to put a few links in the chat box of PFCC Partners website and PFA Network if you would like to learn a little bit more. And with that, I would like to introduce our presenters today. So our topic for today is patient and clinician perspectives on open notes, how transparency can forge better care and stronger relationships.
Oh,
so,
you didn't run over my thing, did you?
Oh, little background, so don't forget to mute yourself. First, I would like to introduce Liz Salmi, who is a patient advocate and senior strategist of research dissemination at Open Notes at Beth Israel Deaconess Medical Center. And alongside Liz is Dr. Sigal Bell, who is Director of Patient Safety and Discovery and at Open Notes and Associate Professor of Medicine at Harvard Medical School. And finally, along with them is Deb Wachenheim, who is Assistant Director of Dissemination at Open Notes, Beth Israel Deaconess Medical Center. And with that, I welcome Liz, and I will stop sharing.
Hey everybody, thank you so much for having us today. I'm going to get my screen up and running and sharing, and hopefully you can see all this. I'm super excited that we're here with you guys today and getting to talk with you about Open Notes. Like Lindsay said, I'm Liz Salmi. I am the Senior Strategist of Dissemination for Open Notes, but I'm also a patient advocate. And my fellow co-presenters, my colleagues, Dr. Sigal Bell and Deb Wachenheim, the three of us are presenting today in kind of three different parts about this concept of patient clinician perspectives on Open Notes. And I'll actually be talking a bit from the patient perspective. Dr. Bell is going to share a bit about the research and a clinician perspective of this. And Deb Wachenheim will close things up talking about how patient family advisory councils and representatives can get involved. We love PFCC partners. We believe in the power of patient family advisors. In fact, I am a patient family advisor that kept working in healthcare to eventually get to work on work like this. So I understand the power of that and respect that you guys are getting involved in this way. We want you folks to know, we recognize you're joining from many different perspectives as advisors or healthcare professionals or other folks. And so we will talk about Open Notes and transparency and a new piece of public policy that's on the horizon. So coming up, I'm going to level set. So what are Open Notes? Open Notes, two words. An open note is when a patient can easily get access to and read their progress note after a medical visit. So that's Open Notes, two words. But Open Notes, as a logo with a purple swoosh around it, is the team that we work on. We're based at the Beth Israel Deaconess Medical Center in Boston, and Open Notes studies the effects of open and transparent communication on patients, care partners, and clinicians. For the last 11 years, we've been working with collaborators around the country to foster and evaluate the spread of open shared clinical notes, which we call Open Notes. And all of our funding comes from federal and philanthropic gifts and foundations. And it's really important to know that Open Notes, us, the researcher team with a swoosh around it, or Open Notes, that two word, is not anything to do with technology or applications. From what we understand right now, there are about 260 organizations around the country, health systems, that are voluntarily taking on and adopting this concept of transparency, of sharing clinic notes with patients. But there's a big change on the horizon where we're going to see this map of 260 organizations actually go to thousands based off of a federal rule that's affecting the entire country. Starting April 5th, 2021, this concept of Open Notes is no longer a thing different health systems opt into, but actually become mandatory. This was the result of in 2016, a bipartisan Congress passed the 21st Century Cures Act. And it's a 1,000-page document rule, but one component of it is this really important thing that the Cures Act wants to empower people in the US to have their health data delivered conveniently to their computers, their cell phones, and mobile applications. And as diverse groups, representing diverse groups on this call, but some of you being patients and care partners, you might know how complicated it can be to request and receive your medical records. And one key component of this rule is that actually it should be a lot easier for you to get this through your computer or cell phone. And I'm showing you this nerdy, wonky slide here to say there's a lot that will soon be easily accessible to you through your online patient portal. Things like your radiology reports, your surgical reports. And one key thing that I highlighted at the bottom, and it's easy access to your progress notes. Progress notes, ambulatory notes, open notes, and that's the thing we happen to have expertise on. So there's so much to this rule. We could spend hours talking about this piece of public policy, but we're going to dive into the open notes component of it. And to get things rolling, I want to share the why of open notes. Like, why should patients be reading this information? Is this helpful? And after I'm done, I'm handing it over to Dr. Bell, who will dig into the research, and then we'll head it on to Deb. So I'm going to give you a patient perspective. Here's a bit about my own patient story. So if we go back to the year 2005, I was 25 years old and I got my first real job and I got my chance to pick a health insurance plan. And my professional background was in design and digital communications. I'm not a healthcare person by trade. And I picked a health plan and a doctor's office based off the fact that they said I could log into this online portal and email my doctor and pick appointments and order prescription refills all on this website. And I thought it was really cool. Well, those skills I got using this patient portal helped me a lot. When 3 years later, I had a massive seizure. I ended up in the emergency department and learned I had a malignant brain tumor. I had a 9-hour surgery and learned I have something called an astrocytoma, which is a slower growing brain tumor, but it has a high rate of recurrence. 6 months later go by, the tumor grows back. And that sent me into this whirlwind of treatments, which was very confusing over the next 2 years of my life, which included a second brain surgery, relearning how to walk and balance, struggling with seizures, and then going through 24 months or 2 years of chemotherapy. It was a lot. There was a lot I had to learn. There's a lot my husband, Brett, had to learn. There's a lot of communication between, multiple doctors and all of my family and friends, but we got through it. And throughout treatment and beyond, I began to continuously rely on the online patient portal. So throughout treatment beyond, I continued to log into this thing and stare at these metrics and graphs and details that were being fed to me about what was going on through my body. And if there were certain words or phrases on this portal I could not understand because I was a healthcare newbie, I would go online to look up what these words meant. What are platelets? What's the WC count? What does this mean? And if I couldn't find what I was looking for online about my health information, I would use that same portal to send my doctor an email to ask a question. Because what use is any of this without interpretation? So fast forward many years, actually not too long ago, back in 2017, my husband, Brett, was offered a great new job. And that meant we had to actually change our health insurance, which also meant I had to pick a whole new team of doctors to handle my care. And we were really scared and nervous about this because I love my doctors, but also felt confident that we would understand how to navigate healthcare and request my records and bring them to the new place where I would receive care. We were really confident, but I had no idea that this process really took a lot of time and effort and that costs could be involved. Now, probably most of you know we have this legal right. We've had a legal right to request and receive copies of our records. But when I asked for copies of my record, I was quoted 15 cents per page or over $700. That's a lot of money. So of course I went with digital copy of my records on DVDs, and I got all these discs in my hand. And I was transferring them to the new cancer center where I was going to receive care. But I spent $45 to get access to that information. And I wanted to know what I had just paid for. So I opened up, this PDF file that was on one of the discs and was surprised to see that my record of 8 years living with brain cancer was over 4,000 pages. It's like, what is in this that could be that much information on this giant file? So I started clicking through this document, and some of the things in my record were things I had seen before, like emails with my doctor or lab results. But the vast majority of information in our records are things like this: our doctor's notes, our clinical visit notes. The notes, many folks know, are the most important part of our medical record. They're there to remind doctors about the patient's plan and care for treatment. They use these notes to communicate with other people on your team. They're seen by everyone who checks in on you. And I was really surprised that I could Google my own medical condition and go online, but I had never really seen what my own doctors were writing about me. I love these notes. They're so fascinating to me. If there's a word or phrase I can't figure out, I will go online to look it up. For the most part, there is not a single thing in these notes I can't understand because I'm the person living with that condition. I was there when they wrote these messages about me. And I get so much value out of them. When in going back and reviewing like the 8 years of my record before transferring my care, I also noticed like snippets of commentary about me as a patient when I was going through that were really made me aware that my doctors are truly listening to me. I don't need to read this, but my doctor's commenting on something really serious I was going through, and she quotes me and she quotes my husband in it. I'm like, this person is really truly listening, and I really don't understand why it took so long for me to get access to this information. And where I receive cancer care today, it's still not easily accessible to me. I have to physically go and say, can I get that note? And I love to look at my old notes to remind me what I need to prepare for in the next visit with my oncologist. So for those of you, I know we've got patient care partner advocates, we've got clinicians and other folks working in healthcare all on the same call. And I'd like to say, if what I have here is a side by side. On the left is what most people see, patients see when we log into our online patient portal. This is a mobile app version, but really it says, hey, Liz, here was your doctor's visit. This is your blood pressure. This is how much you weigh. And that's the amount of information my health system gives to me, which really I already know that information. Reason for visit, brain tumor, and here's some stats. But meanwhile, what my doctors see and other people within the health system see about me is this rich, detailed information about how I'm doing as a person living with brain cancer. And really, it's that detailed stuff that I want to know about and see, and that I want to share with my husband when we forget and disagree on what the doctor says. So it really helps out. So finally, I want to leave you with this. I love this quote, because as we're moving to an era of transparency where people will have access to all of our information through the portals, to be able to see that doctor view, there are some concerns and anxieties clinicians have about, can patients understand this? And I remind those who are listening in that engaged patients have better health outcomes and better healthcare experiences. So we'll soon be exposed to more information, but we need that information in order for it to translate to knowledge to become these more engaged patients. So I'm going to stop sharing, and I'm now going to hand things over to my colleague, Dr. Sigal Bell. And Dr. Bell, I don't know if you're muted.
You always need the unmute reminder.
I got your back. I got your back.
Lindsay started, we've been Zooming for a year, and I thought, gosh, that's a long time to be unmuting. Okay, take two. I'm Sigal Bell. I'm a physician at Beth Israel Deaconess Medical Center, and I've been working with OpenNote since its inception in 2010, so for the last decade. So I'm really excited to share with you just some of the highlights of what the research has looked like over the last decade. And so let me get our next PowerPoint bullets up and going. There we go. Okay, can everyone see that screen, what the research shows?
Looks good.
We're good to go. Super. So I thought I'd start with where OpenNote started, at least as far as the research goes, which is this original study in 2010. And at that time, 105 primary care clinicians volunteered to participate in this experiment. They invited about 20,000 of their patients to read their notes through a patient portal online. Those patients were being seen at 3 healthcare centers across the country, at Boston, at my home institution at BIDMC, in Pennsylvania at Geisinger, which serves a rural population, and in Seattle at a University of Washington hospital at Harborview, which is a safety net hospital serving urban population. The way that the intervention was evaluated was through pre and post surveys administered for both patients and clinicians. And really, the investigators were interested in two kind of primary outcomes. Would open notes help patients? Would it help them engage in their care? And then on the flip side, what happens with clinicians? Will it affect their workload or affect their job demands? And at the end of the study, this question was evaluated with a really simple, actually elegant binary question, yes or no. At the end of 1 year of sharing notes, will patients and providers want to continue with open notes? So what happened? Well, a year later, now we're looking at data from thousands of patients who were able to read their notes and read at least one note. And of those patients, 75% reported important benefits and engagement related to better understanding their care, feeling more in control, planning for next visits, remembering next steps, and also related to adherence in taking their medications as prescribed. Very few were confused or worried or offended, although providers really worried that that might be the case before the study started. Interestingly, at the end of the year of sharing notes, 85% of patients said that they would use open notes as a criteria for deciding on how to select their provider or their healthcare center. So as you can imagine, that got the attention of the C-suites across the country. And here's that single binary outcome at the end of the year. It's actually an astounding statistic. Thousands of patients, 99% wanted open notes to continue. Well, what about the clinicians? After sharing notes, the majority say that sharing notes is a good idea and it's helpful for patients in terms of engagement. Most would recommend the practice to colleagues. Before open notes started, many clinicians had concerns about time, and those clinicians on the call now who aren't sharing notes yet may share this concern. But after actually opening their notes, very few of those concerns materialized. In fact, an interesting study out of one healthcare center documented note authoring time in the EHR. So although the clinicians in that organization showed a similar survey response of concern about spending more time, the actual note authoring time after sharing notes did not change. In several of the centers that are using open notes, people have also tracked messaging through the portal. In our own organization and in several others across the country, there was no change in electronic messaging after sharing notes with patients. And at the end of this experiment, when doctors had an opportunity to turn off open notes because the year of the study was over, no doctors shut it off. These results have now been repeated in several organizations across the country. And again, we're seeing really the same themes emerge. Well, since that time, there have been over 100 papers that have been published in numerous different topics and specialties. I've highlighted here 3 areas that I'll touch on briefly today: quality and patient safety, care partners or caregivers. There's been work on pediatrics and adolescent populations as well, vulnerable populations, mental and behavioral health, chronic illness, oncology, and the clinician experience. And if you're interested in learning more about any of these topics, let me just point you towards the website, which had this cool refresh on a research search function so that you can go in and really type whatever it is you're interested in learning more about, and just a wealth of resources, our own studies and those of other researchers across the country that are engaging in this kind of work. So now that you have the background, let me tell you a little bit about what stands out to me as a clinician researcher over the last decade working with open notes. And one of my great joys over the last decade has been working with our PFAC. I've actually done many studies that have involved patient participation right from the beginning of our work, and I find it incredibly rewarding and insightful. So this is our PFAC here at BIDMC. And one day I was talking with one of our PFAC members, and he was describing to me the experience of leaving an office visit. This particular PFAC member is a caregiver for his sister who was dealing with complex medical issues. And he told me that when he leaves the office, he walks out and suddenly he says, "You're like did they say this or did they say that? It's like you have big amnesia. And I thought to myself, like, this term, big amnesia, is so true because it affects all of us. It affects me as a patient. It affects many of the patients that I care for, because there's just so much to try to remember and a lot of emotion and anxiety around, the healthcare visit, which we know makes it difficult for patients to hold on to all that information. In fact, in the literature, 40 to 80% of all healthcare encounter information is forgotten or misremembered. And this is made worse with stress, with complexity, with language barrier, et cetera, which are basically all the conditions that we're dealing with now in the time of COVID. So not only do patients feel anxious, providers are feeling anxious, we're relying a lot on telemedicine and its potential for communication glitches. At the end of this telemedicine visit that we see, this pictured here, this woman will shut down the screen and there is really nothing left, right? There's no like tangible remnant of that visit. And in addition to that, we have many more deferred visits where we're relying on patients doing care at home. And so for all these reasons, the written record is particularly important at a time like this so that patients can remember the visit and the next steps. Well, this sounds pretty simple, right? Like here's a written record so you can remember what happened at the visit. But as I started thinking and researching, what does open notes mean for patients and families? I really got completely enamored by this space between visits, by this idea that we now have a tool to help patients in that space between visits. So, this picture shows kind of this simple thing, a person who's going from point A to point B, and the hypothesis is if you help them along with the information to get from one place to the next, that's a good thing. But what I'm thinking is that this is more than information. If you give patients access to their notes, in addition to remembering the next steps, well, now they have a whole library of understanding the rationale for those steps as well. And if you are a provider like me who focuses on ambulatory patient safety, you really care about this space from point A to point B, because in ambulatory care, that's where a lot of the hazards arise. Unlike inpatient medicine, where it might be, a singular problem like the wrong dose, or God forbid, the wrong site surgery or what have you, in ambulatory care, it gets a lot more murky, right? It's like the missed follow-up or the step that didn't happen or the communication that didn't go from one doctor to the next. It's this very difficult space in that space between point A and point B. And if you're a patient navigating that space, well, it can be confusing, right? That path is not always linear. There are lots of twists and turns that come up, and we don't always have the right guidance to get us across the way. So our hypothesis was that open notes is going to be really important for ambulatory patient safety because of helping patients between point A and point B in all of these ways. Well, that's what the data showed us. So we surveyed over 10,000 patients and families at 2 academic centers in Boston, and we were focusing specifically on the hot button issues in ambulatory safety, on tests and referrals. And we wanted to know, did reading notes help these patients and families with several of these functions here related to tests and referrals on the left-hand margin? We looked at a 4-point Likert scale from not at all to very much. And you can see that for each of these, understanding the reasons for the referral, understanding why the provider ordered tests, and more likely to check test results, 75% roughly of patients, parents, the parents of pediatric patients, and caregivers agreed that reading notes really help them to understand the rationale and to check the test results. In addition to that, roughly 50% or more said that reading notes help them to actually get that thing done, remember to go to the appointment, or remember to get their tests done. What you can see along these bar graphs is that even though we're looking at 3 pretty different populations here, adult patients, parents, caregivers, the results track fairly similarly, building our confidence in the validity of the results. And in addition to that, an interesting little tweak that those purple bars, the caregivers, boy, are they most endorsing of the benefits of having access to notes and its impact on patient safety. And that's an important flag for us, a way to support those caregivers. So this particular piece, using open notes as a way to help complete follow-up and test referrals or remember next steps or get patients from point A to point B, this idea of loop closure, which is so central to patient safety, is one of the main tenets or principles by which open notes serves as a safety and quality strategy. There are a couple of other ways that open notes is important. What we've seen over the years is that patients and families can identify breakdowns and documentation errors in their record that clinicians may not even be aware of. And this really resonates with a mounting evidence base now in the literature of patients as safety partners, being able to recognize these issues and bring them to the attention of their providers. When you think about that on an individual level, I spot a problem, I share it with my provider. This really changes the game, right? Because the EHR now becomes a learning EHR. There's someone else on the other end that can read it, identify problems, and let the provider know about it. Prior to that, it was sort of living in cyberspace or in the healthcare system where only the providers were the check. Now there's a math game, right? You could have, one provider with eyes on 1,000 records, or you could have one patient with eyes on their own record. Who's going to be able to pick up, more of the problems there? So on the individual level, this learning EHR, on the aggregate level, we can learn important things about organizational safety and use that as a vehicle to improve the quality of our care. The third way that Open Notes serves as a safety and quality strategy is by building stronger partnerships between patients and families. I know that that's what this organization is all about. So being able to share notes increases the trust, right? I mean, it's natural to imagine, how can you really have trust without transparency? It improves the teamwork. We're on the same page, literally. We're working together to improve your care. And it increases, it turns out in the research, alignment, meaning that patients feel that their own goals are in greater alignment with their provider's goals by virtue of sharing this record, by virtue of sharing notes. And based on this data and other data, Open Notes has now been recognized in the safety literature in the Lucian Leap Institute and PSF now, IHI, a lot of word acronyms there, safety white papers on transparency and patient engagement, in the landmark NAM report on improving diagnosis, and most recently in the National Action Plan that's been put forth by the Institute for Healthcare Improvement. So you can see and read more about it there if you'd like more details. I just wanted to show you a snapshot of the data regarding the patient-doctor relationship. So, when Open Notes first started, there was a lot of concern. Are patients going to read notes that they find erroneous or offensive, and will this damage the patient-doctor relationship? But the data actually shows that 99% of patients at 3 sites, thousands of patients, felt better or the same about their doctor after reading as few as one note. In a second study at 2 sites, again with this population of 10,000 patients and families, over 97% reported the same or greater trust, teamwork, goal alignment, and activation after reading as few as one note. And something interesting happened when we went back and we looked at that population that felt better about the doctor, and we stratified by race, ethnicity, and education. We got one of the first signals that we have seen over the last decade regarding the specific benefit of Open Notes for vulnerable populations. So somewhat surprising was that, sorry about that. It was so surprising, I jumped right ahead. Somewhat surprising was that it was not the educated mainstream patients that people sometimes assume would be most likely to benefit from Open Notes. It was actually Black, African American, Asian, elderly patients, those with less than or equal to high school education, patients who often are considered within more vulnerable groups, who were significantly more likely to feel better about the doctor after reading their notes. So this caught our attention, and we went on to look at some other analyses focused on these vulnerable populations. Here, I'm showing you just a comparison in race and education, but we've also looked at language preference and other markers in terms of more vulnerable groups. In this particular study, one site, nearly 7,000 patients, and we looked at 5 patient engagement behaviors shown on the left. We asked patients, how important is reading your notes to accomplish these 5 patient engagement tasks? And they rated their responses for each on a scale from 0 to 10, not at all to extremely important. And what we're looking at here are those patients who said that notes were extremely important. What you can see is that for each of these engagement behaviors, in this particular case, Black patients as compared to white in the purple bars, Black patients is the darker purple as compared to white patients, and less educated patients in the dark orange compared to more educated were significantly more likely to say that reading notes is extremely important to engage in each of these behaviors. And when we went on to look at a multivariable regression, accounting and adjusting for all of these factors in terms of sociodemographics, individuals who self-identified as Black or African American, Asian, Hispanic, Latino, other or multiple races, or who had less than or high school education were 2 to 3 times more likely to report notes were extremely important to engage in their care as an aggregate measure of these 5 behaviors. So let me just take a moment to say a word about care partners. I mentioned to you that this is a group who is particularly likely to benefit from access to notes. Those of you who serve as as care partners know that already intrinsically from your own experiences in terms of what would have helped you if you didn't have access to those notes already. And I can say in my own life as a daughter to an elderly mother, this has come up frequently. Care partners represent 40 million Americans is the estimate, and they are key stakeholders in the healthcare system because of the costly, preventable, high stakes errors and readmissions in those vulnerable patients that they help to support. Unfortunately, care partners often lack access to critical information. And this is really a missed opportunity, right? Because family members are amongst the most vigilant of healthcare system stakeholders. In our research, care partners report that reading notes helps them with medication safety and adherence, with test and referral completions, again, with those relationships, the trust and the teamwork and the goal alignment, particularly important in this population, and in the identification of documentation errors. So again, just underscoring the evidence that we've already seen in particular for care partners. So let me come back around to the comment that our PFAC member made to me about the power of print, about the big amnesia. Did they say this or did they say that? And this idea that sharing notes would be a way to close that gap, to help patients remember those next steps. And in fact, it does. Patients better remember. They talk a lot about being able to read their notes in a more relaxed environment, right? In their own home, at their own pace, kind of digesting information in their own time. But that's not the whole story. What we've learned over the last decade is that sharing notes really has direct safety implications beyond just remembering. It can have particular benefits for vulnerable populations and for care partners. It also has an interesting relationship to behavior change. We've heard stories about patients printing out their notes and putting them on the refrigerator, particularly when it involves motivational changes related to diet or nutrition or exercise. There's something about seeing it in black and white, right? The power of those words, different from hearing it in the healthcare visits, something about seeing them that can help motivate patients. There's also an interesting effect on accountability. So it used to be that, patients would come in, go to their visit and then leave. And then some period of time later, come in and maybe see a different doctor or maybe even at a different center. And it was sort of like these little moments of touchdown with the healthcare system. Well, now the story changes because things become integrated. There's a whole story, there's a point of reference. You can go back to your record and see how things change over time. And what patients say is that that longitudinal access actually gives them a sense of greater accountability. And then, not to be forgotten or underemphasized, are these relational benefits. So it turns out that it's not just the print, it's what is between the lines that really matters too. The note becomes evidence of caring, right? The patient can see what the doctor was thinking, not just in their clinical um, progress or diagnostic process, but also about caring about the patient, evidence of caring. And we hear time and again that when patients read their notes, they think, wow, like she really gets me, or he really listened, or she really understands. And those relational benefits are powerful. On the clinician side, it's really interesting that all this time that we spend documenting is now suddenly visible to patients, right? You are spending the time anyway. Putting it in front of the patient helps them to see that time you're spending thinking about them. And what we've seen, even for those patients who choose not to read notes, and there will be patients who do that, just the invitation alone is a powerful gesture of inclusivity and of transparency and of trust building. So lots of benefits from patients who read visit notes. We've talked about a bunch of these, but the key message that I want to bring home is that in order for us to help patients achieve these benefits and build resilient healthcare systems where we develop strong partnerships between patients and clinicians, we have to actually get patients to their notes. It's not enough to flip the switch and say, yes, we're doing open notes. We need to actually make sure that patients can access and read their notes. And with that, I'm going to pass over to Deb, who will tell us a little bit more about how to make this happen.
So I'm going to quickly share my screen. I know we want time for questions. My slides are quick. So okay, so Deb Wackenheim, I'm currently at Open Notes. I know some of you, I haven't looked at all the names quickly, but I've also been in the PFAC world, mostly in Massachusetts. So I love talking to groups that include members of patient and family advisory councils. So as you just heard from Sigal, patients need to know that there are these things called notes and how to find them in order to be able to reap some of these benefits that she talked about. So, you know, over the years that we've been working at Open Notes, we've been working with health systems to provide them with tools and resources to implement Open Notes. We always tell them it's very important to let patients know what are notes, how can they be beneficial, and how can you find them? What is a patient portal, and how can you find your notes on the portal? Some health systems actually open the notes and don't tell anybody. And like I said here, this may decrease clinician anxiety if they're told, well, yeah, you'll be putting these notes out there. I mean, they probably don't say this so boldly, but kind of the message of, you know, but we aren't really going to tell people. But again, then there won't be any of these benefits that we've talked about around patient engagement. So some of the ways to try to increase patient and care partner use of notes are through marketing campaigns. There are certainly marketing campaigns around patient portals that we've all seen. So now there can be a campaign specifically around notes, and that also will increase registration on the portal, is what we've seen. Clinicians encouraging patients. I'm going to be putting the notes from today's visit on the patient portal. I encourage you, within a couple of days, it'll be there. Go in, take a look. It'll remind you what we covered today and your next steps. Systems can put in place automatic notifications that a note has been uploaded to the portal. So a patient sees a text or an email, and that's the reminder, I can go in and find this note. And also making it easy to navigate to notes once you're in the portal, which we have seen improvements in some of the vendors that have had this functionality for a while. They've become aware of how difficult it has been to find notes. And that's also, the health systems have to work with their vendors to make it easier. So patient and family advisory councils can partner with their health systems to work on those marketing and educational campaigns. They bring their patient and family voice to saying, how can we make sure that patients and family members know about notes and how to find them? Give feedback on the patient portal broadly, because you want people to be drawn to using the portal. So how user-friendly is the portal? and then give feedbacks on both how easy it is to find notes within the portal and more broadly on how the Open Notes implementation has been going at your health system, how you as an individual patient or care partner has been able to utilize notes or not utilize them, and how it could be improved. So we have a lot of information on our website. There's a section for healthcare professionals and there's a section for patients. Of course, anybody can look at anything, but they're more targeting certain audiences in all these different areas that Sigal touched on earlier that we've done research, as well as FAQs, how to communications campaigns you can do, etc. So I encourage you to go onto our website. We also have a patient and family advisory toolkit. So if you go into that patient section, you will see a toolkit specifically for patient and family advisory councils. We have wonderful videos. We've been doing a series of webinars, and I think some people voiced that they've been to some of those in the chat. And those are continuing, as well as office hours where you can just go in and ask questions. And we, as was mentioned earlier, our research page is very user-friendly. You can go in and say what topic you specifically want to find research on. And as I posted multiple times in the chat, next week we're having drop-in clinics 2 hours every day, leading up to when this federal mandate to share notes goes into effect on April 5th. And you can find this on the homepage of our website. You can just go right into Zoom if there's a time you want to pop in for 5 minutes, for an hour, however long you want to be there. And we do have experts on particular areas coming on certain days. So this is all on our homepage. And there is kind of the list of all the experts. Again, I won't go through this right now, but you can find us, and we have some great folks in many different areas coming. And our next webinar will be Open Notes in the Safety Net, featuring speakers from LA County Department of Health Services and from the Institute for Family Health in New York City. And they've been doing some great work. There will also be office hours where you can just drop in and ask questions. And that is on our website as well. You can register for those. So thank you very much. Time for Q&A.
Wonderful. Wow. Thank you, each and every one of you, for that incredible amount of information in such a short amount of time. I really appreciate it. So we had a very robust conversation going on in the chat. So many questions, which I appreciate every single one of them. If we don't get to your question today, we will do some follow-up. We'll reconnect with Open Notes offline and answer any questions that we didn't get to. So don't fret if we don't get to it today. I also just wanted to reinforce those drop-in clinics as well. Those sound like a really great opportunity to get specific questions answered for really specific topics like mental health, which we had a lot of questions about as well. So encourage you to go there. One of the first questions that I wanted to bring was one that was mentioned a few times in the chat here today, and then we got some questions in the registration about, and maybe Dr. Bell, this one would go to you, but there were many questions about patients making edits to their notes or requesting to make edits to their notes. I'm curious what insight you have around that and the implications on the medical records team and anything that goes into that process of patients requesting to make a change.
Sure, that's a great question, Lindsay, and it comes up often when we talk about Open Notes for two reasons. One is that providers get nervous about that question. I will say that in our experience, both in terms of specifically asking patients whether they've contacted their provider's office about a concern related to their notes, and from anecdotal experience of what we see and hear from organizations, this happens relatively infrequently. When patients do contact their clinician's office about a concern in their note, oftentimes it's a legitimate concern like an error or something that should be addressed in terms of not understanding the plan of care. Patients also say that they reach out just to gain clarity because they're confused about what to do next. So in many of these instances, when patients do reach out, it is for the improvement of the quality of the actual care delivered. But it has not shown as a major signal in terms of the workload. It's actually been much more rare than you would anticipate. We hear about this question on the flip side too, in terms of how do we harness the amazing information that patients have about themselves, about the care that they receive at centers outside of the one where that particular note is being written, in order to improve the accuracy of records. And in that conversation, systems have a way to go, I think, before they can develop a systematic way to receive patient feedback about their notes. But I do recommend that as organizations are mounting open note processes, that they begin to think about having a structured way, at least to direct patients about where to go with comments about their notes. In the best case scenario, this should be a centralized workflow so that it is not coming back to a provider in a one-off way. And that is both for the purposes of preventing burnout and keeping workloads moving smoothly, but it is also for safety and learning purposes. So if we can look at those reports in an aggregate way, we can learn more about what patients are correcting than if they're happening in a one-off way. So lots of thoughts on that issue. Actually, it's one of the things I do at the BI. We built a specific patient reporting tool in order to solicit that information and see if we can proactively improve safety. And I hope that other organizations will begin to think about other patient engagement mechanisms as such in the future too.
Great. I like that, as using it as a quality improvement activity too. So you're continuing to improve. Yeah, sorry, Liz, go ahead.
I just want to add on like 20 seconds to that. And one of the things I get to do with Open Notes is talk to a lot of different health systems around the country who are now trying to figure out, oh my gosh, we have to implement this rule. We're gonna get so many questions from patients. Are they gonna ask for a lot of changes to their records? So if you're a clinician, if you work for a health system, there's somebody within your health IT department who's figured out what this process is for you. They've got to get it figured out. So if you're a clinician and you're like, what is that process? Go ask, because they should have it developed by now. And it'll be interesting to see what happens after April 5th.
That's helpful. Yeah, thank you. Lori, you had your hand raised.
Thank you, Lindsay. And I just want to say thank you for this presentation. It's really helpful, and I can't wait to share it on social media. My biggest question, I think, is whether whether the rule will require hospitals, especially for ER visits. So can a patient quickly get a hold of their progress notes or their diagnostics from the ER, or is this just their primary care office, ambulatory care?
So the rule is all of the information in the record, and the full rule. So 21st Century Cures Act, then it goes into rulemaking, and now it's through the Office of the National Coordinator for Health IT, through the Department of Health and Human Services. So that whole rule is 1,000 pages or so. And then the section about what in the record needs to be shared, and with progress notes being one of those things, is just a few pages or so. And one of the things, one aspect of the way that's written, it's a lot of very bureaucratic language. It says the information should be available to patients upon request, like a digital request, clicking a link, without delay. And so there's been some discussion around, what does without delay means? Does that mean the moment a clinician has hit sign off on note and post to the EHR, the patient also gets a little ting? Is it within an hour or two? Is it within 24 hours? So the folks within hospitals that think about the delivery of health information, often like the chief medical information officer and their team, the without delay is they don't say in the rule what that timing is. So they're kind of interpreting it. And we just did a webinar earlier this week, where University of California, San Diego Health talked about how they're interpreting the without delay. If in ambulatory, it's right away. If it's in ER or hospital visits, they are releasing that information, they've decided, when a patient is discharged. So if they're in there for 2 days, they'll get it when they leave. If someone's in there for 2 weeks, you'd think care partners would benefit from having that information in real time, but this is what they're figuring out. That's their particular decision, but it may be different at different organizations. Hopefully that really long rambly response lets you know that we still don't really know what this is going to look like everywhere, and it might look a little different in different places.
Thank you.
Yeah.
Great. Thank you, Liz. All right, I wanted to bring another question that was raised in the chat that I thought was really interesting. And Dr. Bell, you touched on this a little bit, but the question is, has there been research with patients who don't speak or read English, thus having challenges with technology or reading open notes written in English, and or have stigma around accessing healthcare, especially for behavioral health or mental health, which we had a lot of questions about?
Okay, sure. Two really great and important topics. So let me start with patients with limited English proficiency, and then maybe I can pass off to a team member to talk a little bit about the mental and behavioral health. I think they've been involved in some of that work or the webinars on some of that work recently. With limited English proficiency patients, our research is limited. So because of the number of patients that we're able to or have been able to survey so far who do not speak English as a primary language, the surveys are in English, reading notes is through the patient portal, the ability to conduct that research is limited. However, from what we have seen in terms of survey respondents with those limitations, the response is incredibly positive. I think the reason that patients with limited English proficiency really benefit from sharing notes is that what they take away from the visit is often limited itself. And so anything additional to that can be really helpful. We know that the use of interpreters is a safety issue in terms of improving the safety and quality of care. But unfortunately, the reality is that interpreters are not always used at every visit where they are appropriate to be engaged. And so as a result, patients often leave the visit kind of piecing together their memory of what happened or relying on a family member as an interpreter, being able to go home and again, review that information in their own time and pace and comfort, or perhaps with a family member, loved one, or trusted friend who can help as an interpreter, really helps patients pick up more of the information that they would not have recalled from the visit. The data suggests that patients with limited English proficiency are more likely to report that reading notes helps them to take their medications as prescribed. So a major, major impact in terms of healthcare policy and the economic implications in terms of, the giant cost to our healthcare system related to medications. So let me pause there. We're doing some more work with LEP patients now using an engagement tool to help work with LEP populations in diagnostic safety, but that data we anticipate will be out in about a year. Deb or Liz, do you want to comment about the mental health, behavioral health piece?
Yeah, and sorry, I was typing when the question was asked. Was it specific around limited English proficiency with mental health or not necessarily?
I think all populations with
Yeah,
mental
I
behavioral
think
health.
because of the amount of questions that we got about mental health, all populations. Yeah,
Yeah.
and I know you have a drop-in clinic coming up, so
Yeah.
but anything that you can touch on quickly for those who are on today.
Yeah, I mean, those who have been sharing mental health notes, including the person who will be at the drop-in clinics next week, who's our colleague, have reported definite benefits in terms of things like patients saying, I read the note and then I saw that you really did listen and hear what I was saying and you really understood what I was saying. And they appreciate the opportunity to go back and read what was discussed in the visit to really get that feeling that they were heard. This comes up most often in mental health and with adolescent patient notes. Most vendors, electronic health record vendors, do have a way to hide individual notes. The federal rule has kind of a list of exceptions that allow for not sharing certain notes if there could be harm. So I included a link in there about some information we have on our website about the federal rule. So many mental health care providers are a little relieved to know, like, if there's an individual note that I think could be, very extremely difficult for a patient to read for whatever reason it may be, I can possibly not share that note. But again, what our colleague and others have reported is that they have not seen drawbacks from sharing notes with mental health patients. And touching on that stigma piece that came up in the question, when a lot of health systems that implemented open notes over the past few years chose not to share mental health notes, we kind of saw that as carving out mental health notes, like mental health is so often carved out separate from the rest of the body, right? So, so we really see it as part of the whole physical health and mental health together in terms of how open notes can help benefit patients and the patient-clinician relationship.
Great. Thank you so much, Deb. Liz, did you have anything else to add to that?
Just on the mental health, I put a link in the chat, direct link to where you can look for the body of research that's going around open mental health notes. And before this ruling, there are about like 40 health systems around the country that decided to proactively share mental health notes, and they were doing well there, so we can learn something from them. What was the other thing I was thinking? We're running out of time. So please
okay.
go on to the next one. Okay.
No, I think because we are right at the top of the hour, I think we will wrap up here, and we will follow up with any questions that we didn't get to today. I will also follow up and share the chat as well. And then if this afternoon you find that you have even more questions, I hope are you seeing my screen again?
Yes.
Okay. If you have other questions, you can please feel free to email me at lindsay@pfccpartners.com. The Open Notes team also shared their information as well. So we'll have a ton of follow-up. We also recorded this session, which we'll share out as well. I want to thank Dr. Bell, Deb, and Liz so incredibly much for joining us for this workshop. It was such a wealth of information, and I really appreciate you sticking around to answer some of our questions as well. So thank you so much. I hope everyone has a fantastic Friday and a wonderful weekend. We have a lot of follow-up to do, which we'll get out in the next week or two. So thank you, everyone, and take good care.
Thank you.
Have a great
Everyone.
weekend.
Thanks.
See you guys.